good evening, good afternoon, good morning. Thanks for joining us at Data Science Nigeria on our COVID-19 Data Science Virtual Conference. It's a best practice sharing session where we intend to explore some emerging best practices, researchers, use cases, and real-world application of data science and artificial intelligence to tackle the pandemic of COVID-19, popularly known as coronavirus. The intention is to stimulate interest and curiosity of our researchers across the world, particularly in our community in Nigeria and Africa, on how we can flatten the curve and ensure that we build solutions that help us to make the world a better and a safer place. So once again, you're welcome. We are privileged today to have experts who will be sharing their research works on opportunities for responding to coronavirus pandemic, biased from perspective of data science and artificial intelligence. If we look today, this is a crisis. The world is on a lockdown, with 1.1 million cases recorded as of this morning. We're glad to see the recovery rate, which also provides us a lot of insight around the profiles of the people who have recovered. What can we learn from them? Over 226,000. And of course, the worrisome cases of death, about 5% of the confirmed cases. What can we learn from this base? We can see the statistics all over the world that this is something that we need to bring the best of knowledge, particularly in artificial intelligence, to proactively address using best knowledge that is available to us. If we look at what we have seen in recent times, particularly from China, it is very clear that we can effectively deploy the power of data science and artificial intelligence to tackle this problem effectively. We've seen a lot of examples: thermal detection, facial recognition, real-time movement tracking via application. So there's sufficient case studies to justify that truly, when we bring together the best of our knowledge, we can proactively tackle this global pandemic. And recently, just this week, there was the Stanford AI conference, e-conference, where some best practices were shared. So generally, we can establish that there are quite a lot of use cases. What can we learn from them? And how can these learnings accelerate our collective research in various domains? We've seen some great work around contact tracing, or what are more like mass surveillance, using location-based data and real-time disease transmission mapping across the world. The issue of managing fake news on COVID-19 is also another critical example of how AI can be applied. Of course, the issues around providing support and help for the vulnerable segment within the population, mapping where they are, and how we can deploy, how we can, provide, some support to them in this particular time. The vulnerable people. Of course, from a planning perspective, data has been sufficiently used from needs and capacity planning point of view based on expected risk index and the number of tests that might be required, number of beds that might be required, and of course ventilators. There's a lot of insights around that. And then robotics is also an area where we have seen massive use cases, especially if we look at China, using robots to support people who are infected, going to them in their isolation centers and supporting their recovery. And then a lot of work around diagnosis. A lot of work has been done in the area of imaging. One of the works that we reviewed at Data Science Nigeria was around using unusual respiratory pattern using ML classifier, which is meant to complement thermal detection for large-scale screening. A work done by Yun Wang and his team at Key Laboreal. So there are a lot of works like this in this regard that want to be reflected on. And of course, we've seen quite a lot around drug research, where a lot of researchers are also bringing together a lot of works they've done and seeing how they can synthesize this, augment the collective knowledge, and see how we can proactively and jointly address this menace. For us, as Data Science Nigeria, of course, we are very concerned as the responsible non-profit in Nigeria on how best we can apply data science best practice to address the menace in Nigeria with 210 confirmed cases based on the pattern of tests that have been done so far as at 10:30 p.m. last night. We're glad about the recovery rate, 25, that's over 10% recovery rate. And of course, this provides us a lot of insight. One of the works we've done is the publication of a massive and inclusive, robust coronavirus dashboard to help bring data from different parts of the world to visualize and in a very simplified and visually engaging manner tell the story. But in addition to that, we also included based on guidance on protective tips. Protective tips are, it's not just knowing the numbers, but how can you also protect yourself vis-a-vis the reality of how pervasive this is, and then the problem of fake news. How do you know what you need to do and what you should not do? In addition to that, we've been doing a lot of work around model development, studying a lot of best practices, a lot around stochastic transmission dynamic models, looking at the cases in different parts of the world and focusing principally on West Africa to see how this is trending, how it's evolving, what are the learning, how can we flatten the curve, how can we tame this elephant in the room and make the world much better place. A lot of our researchers in Data Science Nigeria have been doing a lot of work. Of course, working remotely around this within the community, and of course, our full-time dedicated staff at Data Science Nigeria. So briefly, I will just introduce you to who we are, Data Science Nigeria. We have a big vision to raise 1 million AI talents in 10 years, solve problems like what we have seen today, social use cases, drive industry application to accelerate industry productivity, of course, drive employment, and of course, drive revenue, cost reduction, and efficiency for companies, and go into transformational research, especially from a multidisciplinary perspective, to see multiple areas where data science can be applied to solve problems in education, financial inclusion, health, economic planning, and climatic research, and so many other areas that will, of course, make the world a much better place. We're also keen around AI startups, businesses that are AI-centric, where AI is the core of their proposition. And we've developed different engagement models across different segments of the country to ensure that we push this frontier proactively and passionately. And we summarize this through our philosophy of what we call AI plus everywhere, everyone, every day. We believe that there's a new genotype. Excuse me, I know we're all familiar with A+, O, and all that, but we believe there's a new genotype called AI+. Is a universal donors of AI knowledge and universal recipient of AI knowledge. This captures our philosophy on democratizing AI knowledge, that irrespective of your field of specialization, irrespective of the work you're doing, you need to embed AI into it as a new standard of interpreting problems, of solving social issues. And that is why our model has been very pervasive, inclusive, robust, on a very large scale across various cities in Nigeria, because we believe that anyone, anywhere, and every day can learn the fundamental principle of AI and can apply it within their domain of specialty and finding that convergence of solving the problem using the methodology and several diverse models and best practices within the AI domain. Of course, these are some of the events we run across the country. We're humbled to run the most inclusive, most pervasive, organic community of AI experts in Nigeria and actually in Africa, based on numbers of footprints that are meeting on consistent basis and the quality of outcome that we're seeing both on campuses and in our various cities. And of course, we believe so much in inclusion, gender inclusion, age inclusion. Every segment of the society must be involved in solving our collective problem. One of our biggest platforms is what we call AI Invasion, which allows us to introduce many people across the country to artificial intelligence for the first time. We just finished one in 17 cities. We are going into 60 cities as soon as COVID-19 is over. We believe everyone must be given the opportunity of knowing the fundamentals of artificial intelligence, and of course support them with learning tools and materials offline, understanding the peculiar challenges that we have in this part of the world to ensure that they're able to sustain the learning, and more important, they can work within the community that will form in each of the cities. And one of our biggest community platforms is AI Plus Clubs on various campuses and also in cities across the country. We meet on a regular basis to share best practices, to work together, to work on competition and also on projects. And our sustainability model is around handing over an offline learning material, which is a collation of over 17,000 publicly available videos from all the major top schools in the world, in the UK, in the US, in Canada, and also of global conferences, New Reads, AI, ICLR, ICML, CVPR. The intention is to address the problem of internet access and power in Nigeria, and making sure that all of this are saved in an external USB of about 4 terabytes, made available free across the country that students can use. And of course, it has a lot of publicly available PDF books that the authors are made free, and of course, datasets available in a pack so that students can just plug to their laptop and learn as much as they want, practice as much as they want, either via videos or reading books. This is what we call Knowledge Box 2.0 with 17,000 videos that we have been able to distribute across the country, and we'll continue to do this as part of our democratization strategy. Of course, for us, AI must solve the problem. We strongly leverage Kaggle and also Zindi as platform to engage our community. We run massive competition with a view to solving specific industry-relevant problems. Of course, this has helped us to onboard a lot of our community members to good jobs in top companies in Nigeria and even outside Nigeria. And we also initiated the first ever artificial intelligence book for elementary and high school in Africa, an attempt to demystify the concept in a very simple, visually compelling, cartoon-led, step-by-step manner with the book, Beginner's Artificial Intelligence, which we're making available across the world and various cities. You can see the level of endorsement that it has seen from top respected experts from Yoshua Bengio, Tyler Liu, William Yusu, and some other global experts who have reviewed the book and saw it as a great way to engage young people, especially those between the ages of 8 and 13, to start adapting, acculturizing, and recognizing AI as a powerful working tool. So the book, through the sponsorship of Softcom Nigeria, has been made available free in many locations in Nigeria, but it's also now available for sales on Amazon, on iBook. Globally, people can buy the book and use it to catalyze the vision to raise more AI talents across the world. But our vision is taking it to nooks and crannies, particularly in whether a public, private, or schools. And that's what our AI Plus community does. This is an example of the work being done by our team in Niger and Kano State. We're taking the book to public schools, in towns, in villages, and getting young people to understand the power of AI, in solving problems. So it's bringing to context their learning on mathematics, on sciences, physics, what does it really mean in the real world, and computer science. So for us, we're excited about this and we'll continue to do more of this. Of course, we run AI Everyday class, which runs at our AI hub, located in Yaba. Every day there's a class for all classes of people, post-university, pre-university student, deep learning, machine learning, Python introduction, R programming, business analytics for professionals. We run these every day. Of course, this is our biggest event in the year, AI Bootcamp, where we bring global experts from different parts of the world to come teach, mentor, inspire Nigerian community. Of course, It's an all expense paid bootcamp, all expense paid, including travel grant to come over. But of course, it's very intensive. Getting a seat requires the student to have learned, followed our 100 days of learning, and also applied the knowledge in solving a problem through cargo. This year's edition is October, so this is the time to get ready to be among the top 250 Nigerian students and professionals that will secure a seat in the most competitive, engaging, immersive learning platform in this part of the world. Of course, young people are not left behind. We run summer schools to engage them, to stimulate their curiosity, and get them to start applying the fundamental principles of AI, machine learning. And then we've also stepped further in our community building effort to lead the charge on how do we collect data, share data, and utilize data that are useful to solving problems that are peculiar to our environment, knowing that some of these data are not available. Based on open data concept, we built many applications, one of which is Data Cloud, which allows us to use locally resident people across the country to collect data in form of text in a survey, images, videos, sound, and of course all data collected are geo-mapped and also geo-fenced, which allows us to be able to get insight by location. And of course, this has been used in many instances for our research and for our work to collect prices of food across the country, seasonal changes across the country, network, electricity quality across the country on a real-time basis. In addition to that, we've used it for social intervention. One of our recent paper was around using real-time data crowdsourcing for effective health policy implementation tracking. We focus on use of ACT drug as malaria first line of treatment. What is the policy implementation? By deploying, people who go to various chemist shops and pharmacy and just ask, if I have malaria, what drug will you recommend? And they collated all those drugs and were able to analyze which are ACT, which are not ACT, and which are not even malaria drugs to understand the level of national compliance. We do stuff like this, make the data available to support governance, to support decision-making and intervention. Like I said, we're well positioned to drive our community towards solving industry problems. We've used that to also onboard a lot of our community members with reputable jobs across leading industries in Nigeria. We've had partnership with recognized and reputable organizations like KPMG, Access Bank, and so many others who have worked with us in different areas. And we are now not just a learning community, but a consulting nonprofit. As of today, I'm glad to say that we're consulting for global development organizations and also local companies, either in form of developing bespoke solutions for them, helping them to analyze their data, helping them to collect data, helping them to build an analytic dashboard system or decision-making system or applications for data interpretation, analytics, and prediction, optimization processes. We're doing quite a lot of that. So for us, consulting is a way to support the development of our community members. So our students are also onboarded into this project as part of their learning, such that they're not just learning theory, they're using this project to build industry-ready skill set. And of course, we have very strong footing within the executive corporate domain, where we run a lot of engagement initiative to get leading decision makers to appreciate the power of AI and data science in decision making through our AI for executive, a lot of engagement initiatives, solution, sharing best practice review session. And of course, we run, whilst 95% of our trainings are free, we also run paid, customized, and bespoke consulting-oriented training for professionals, where we help them build industry-ready skills in the area of analytics and data science and specific to their industry. It runs for 5 weeks, some might be 6 months. They're driven towards solutioning for the industry and also for certification. So, and we're proud to say students, as soon as they are done from this program, they can apply the learning. Why? Because a model is hands-on, a blend of theory, and of course a blend of practicals. And we are always very proud to say these classes are led by people who just don't read data. These are people who have practiced data at C-level, at board level, to help business make decisions and drive impactful growth that's been proven over the years. So all this knowledge are made available. Of course, these are the funding opportunity that we also have to scale up as Data Science Nigeria, to do more of our free trainings and distributing free books, distributing free AI knowledge boxes across the country to ensure that we achieve our vision of 1 million AI talents in 10 years. Of course, we are also very keen around solving local problems. One of our solutions is AI for education, where we use AI to track student behavior in class with a view to building optimization algorithm that maps changes in children behavior in class in terms of engagement level, how they raise their hand, how they sit, stand, move, engage their friend, and how that has impact on their academic performance. Because it's about building framework that can support the teachers to better understand their students, since they may not be able to understand what is happening in the class. AI can, of course, be a complement. That's why we call this AI class monitor. Of course, we are very inclusive, and that is why we kicked off Ladies Like AI by Data Science Nigeria, which is meant to be a mentoring, networking, community building platform where ladies who practice AI and everything data in Nigeria across various industries meet on a regular basis to support themselves, both physically and virtually, and provide mentorship for young female students in university who want to build career in AI and data science. Our desire is that this platform can help us to inspire many young Nigerian female folks to fulfill their dream of being world-class data scientists. And I know that women are great in thinking, in decision-making, very robust cognitive power that we can apply in solving real problems. And of course, we are part of global community. We are always a global platform to make presentations, to share our scientific work. For example, we had the last AI conference, which took place in New York early in the year, where we spoke on AI for social good, and we shared best practice around the compositionality of AI for social good concept or construct. And now it can be more inclusive in solving local issues, such that it goes beyond research to real on-ground solution delivery platform for socioeconomic and welfare of the people. So we always say we are very humbled to have built 26 unique platforms that is touching hundreds of thousands of people, face-to-face, online, offline, and hands-on across various segments using a massive, different, diverse, yet inclusive, robust, large-scale approaches to ensure that we can reach more people, democratize knowledge, and make impact as we always want to do. So you can download our annual report. We are a registered charity. And so we have solid governance led by very reputable advisory board. So you can download our annual report to know more about what we do and get involved in our community by attending our classes, supporting us, sponsoring our students for PhD, sponsoring our event, sponsoring a research work, and any other thing you would like to do. Just download our annual report. So this is where you can follow us. We run events almost every week. We review papers, so you can follow all our digital footprint, website, Twitter, Instagram, Facebook, and of course, YouTube. So just to mention before we go to class that next week we are kicking off our virtual bootcamp. Is a 5 days learning. It's AI Everyday Virtual Bootcamp. We have 5 experts in different parts of the world who will dial in between 5 to 7 p.m. Nigerian time. Nigerian time is GMT +1, so do not miss it. It starts next week and it's going to run on our platform on YouTube, so track our YouTube page. Register for a seat as shown on the screen so that you can get linked to follow the class. The class is for all classes of people, so whether you're a beginner, whether you are an intermediate, whether you're an expert, the class is structured such that you can pick something relevant to you. whether you're an industry practitioner, you're a beginner, you're an enthusiast, you're a core researcher, there are a lot to learn from these fantastic experts in different areas who will be sharing best practice and knowledge. So, welcome once again to COVID-19 Data Science Virtual Conference. I'm excited about our experts who will be teaching us this evening, afternoon, or morning, wherever you are. From Data Science Nigeria, we have the team of our research lead, Wuraola Oyewusi, who is a data scientist and a pharmacist. I will be sharing a work she's done on how to explore COVID-19 data as a way of stimulating, number one, learning, and more research work based on some of the things she's working on. We have Rising, one of our research interns, a computer scientist. He will also be sharing the work he did with Brain Aboze, who is also our research intern. Both of them have done a work around optimizing assets in terms of medical facility for a time like this. How best do you use geospatial data to optimize distribution of health facility, especially a makeshift health facility, which is what we're seeing now. And we have Olawale Abimbola, who has done a lot of work on disease modeling using a lot of global best practice in pattern of transmission. He will also be sharing the work. So once again, I'm excited to present to us our guest speaker, Elaine Nsoesie, PhD from Virginia University. She's an assistant professor of global health at the Boston University School of Public Health. She's a computational epidemiologist, combining research interest in statistical computational approaches for public health surveillance, modeling of infectious diseases, and understanding of disease spread and public health practice. Join me to welcome our first speaker for today. It's always a great pleasure to have her. She is an inspiring, motivating, and a supporting member of Data Science Nigerian community, even though she's based in the US. She was with us last year in Nigeria to teach at our bootcamp. Join me to welcome the ever-passionate Elaine to lead us on data science best practices to tackle coronavirus. Elaine, you have the floor. Thanks for joining us.
My name is Elaine Nsoesie. I am an assistant professor of global health at Boston University School of Public Health. I'm also a computational epidemiologist. I develop tools and methods for monitoring the spread of infectious diseases and also chronic prevalence of chronic conditions in the US and in African countries as well. A lot of my work has focused around using digital tools. So how do we use data from places like social media and Google searches to monitor how diseases spread? But I've also looked at things like satellite images, how satellite images could be useful for monitoring the spread of infectious diseases or reports of infectious diseases. I've also looked at things like restaurant reservations. So if a lot of people suddenly start canceling the restaurant reservations, is that information that can be useful during pandemics or infectious disease outbreaks. My PhD dissertation was actually focused on forecasting the spread of infectious diseases, and it was inspired by the 2009 influenza pandemic, which most people heard very little about, since it wasn't as severe as the coronavirus, but we did have a pandemic in 2009, and that inspired most of the work I did for my PhD around developing methods to predict how an influenza epidemic or pandemic would spread, and how things like social distancing and closing schools and other social distancing measures could limit the spread of disease. So for this presentation, I'm going to tell you a little bit about some of the work we're doing and some of the work that's hopefully going to inspire more work towards coronavirus disease. And I'm hoping that a lot of you are already thinking about what you can do. And even if you're not doing anything in this space right now, like everyone is now required to do something, staying at home, taking care of yourself and taking care of your family and people in your community is enough work. So there are lots of things we can do around that, around volunteering and making sure that the people around us are okay. So before I get into some of the projects we've been doing, let me just start off by talking a little bit about coronavirus disease. So coronavirus disease is an infectious disease and is caused by a newly discovered coronavirus. Most people who get infected will experience mild illness, and people who are over 60 years of age and have underlying conditions such as cardiovascular disease and diabetes are more likely to have severe disease and are therefore advised to avoid crowded places or places where they might interact with people who are sick. But this applies to all of us. It's not just people who are over 60 who should be avoiding crowded places. Any of us can get infected and transmit disease to someone who's over 60 years of age or someone who has underlying conditions which increases their chances of having more severe illness and possibly death from this disease. So it's important for all of us to think about what we can do to protect ourselves and to protect the people around us. And the best way to do that is to learn as much as we can about the coronavirus. There's a lot of information on places like the WHO website. There are lots of papers that people have written about coronavirus. Not everyone is going to understand those studies because not everyone is an epidemiologist, but you can find summaries of the studies and new findings on places like the WHO website or the US CDC website, or even places like the Nigerian CDC as well. Those are all sources of information that can be useful and can inform the decisions that you're making. So here are 5 things that you should think about and try to practice during this time to save lives. So stay at home as much as you can, and this basically means that avoid crowded places. If we don't avoid crowded places, we're likely to get infected at those places because you have so many people together. And so if someone is sick and they sneeze or they cough, either on you or into the air where you're standing close to them, you can breathe in the virus. And or if you touch something that has the virus, then and you touch your face, you can introduce it through your eyes, your nose, your mouth, into your body. So it's very important for us to practice social distancing. Keep a safe distance between yourself and others. So this means when you're out in the grocery store or in other places, try to make sure that there's at least 6 feet between you and the next person. Wash your hands often. This helps. If you have the virus on your hands, when you wash it with soap, it's going to cleanse the virus off your hands. Cover your cough and your sneeze, so cough into your elbow or cough into a tissue. And if you cough into a tissue, make sure you put it in the trash. And if you're sick, I know there are numbers, emergency numbers that have been provided for most African countries. You can call those numbers and inquire how you can get tested or how you can receive medical care. Some of the things you should be paying attention to are, or some of the symptoms you should be paying attention to include fever, tiredness, dry cough. Other symptoms include shortness of breath, aches and pains, sore throat, and a very few people will report diarrhea, nausea, or a runny nose. But these are all symptoms that you should be aware of. If you have those symptoms or someone else close to you have those symptoms, you should call the emergency number and inquire what you need to do to get a test. So the work that we've been doing so far can be placed into 4 different categories: prevention, addressing misinformation, data collation, and visualization. So around prevention, we've worked with different people in different countries. So the first collaboration was with the Ministry of Basic and Senior Secondary Education in Sierra Leone, and what we did was develop these cartoons with information for people to know what they needed to do to reduce your risk of coronavirus disease. So things like washing your hands regularly, not touching your face because you can introduce virus into your eyes or nose or mouth. Avoiding direct contact with people who are sick. So this is creating distance between yourself and other people, but also staying at home as much as possible. If you're not feeling well, staying at home so you don't go out into public and infect other people. And like I mentioned before, always covering your sneeze and your cough, because that's how the virus gets transmitted from infected people to non-infected people. We've created these posters in several different languages. So the first version was in Sierra Leone and Creole. This version is in French. We've had versions in Spanish and other languages as well. We created similar posters, but this one specific one is in Swahili, and this was created by an artist in Tanzania, and I really liked it because it gave us an opportunity to work with a local artist and help them, make money in this case. So they actually paid to create this. And that for me, I think is something that's important, thinking about how we can support local artists and local businesses in our communities. These are things that you can do. So if you're interested in editing these posters into different languages and distributing them, whether it's on WhatsApp or email or other sources, that would be great. For Sierra Leone, they actually printed this out on paper and distributed it in communities. So that's something that can be done as well. Just make sure that you put distance between yourself and people and that you're not standing too close to people when you're sharing this information with them. Prevention, I think, is the greatest thing that we can do about this outbreak. We can, try to do a lot of other things, but just making sure that we are taking care of ourselves and the people around us and the people in our communities is the best thing that we can do right now. And public health officials are trying to do the best they can, and it's definitely challenging because certain things like social distancing that might work in the US might not work perfectly in Nigeria because you have a lot of people that depend on a daily wage to eat. And if they don't have access to food or water, then that makes it difficult for people to actually obey rules around lockdown and other ways in which social distancing has been implemented. So I think that's something that we can collectively think about and maybe try to find ways in which we can practice social distancing while taking care of each other. Another thing that I've been working on is misinformation. I tweet a lot about this. I also have a blog, and I'm also writing articles for academic journals as well. For those of you interested, I should have at least, I think, one paper getting published in the next couple of weeks. So you can watch out for that if you're interested. And I think that's something that we can all do as well, fight misinformation in our communities. There's a lot of misinformation about what can treat and what can prevent coronavirus infection. And a lot of it might seem harmless, but this can have significant impacts on some people's health that maybe we don't know completely. And we know, for example, that during Ebola, there were people who drank salt water, in Nigeria and actually died because of that. And so we don't completely know how over consuming too much of whatever people claim, if you consume whether it's peppers or different things, onions or other things, what it might do for people that are already sick with other conditions. So it's very important to think about that. Some ways in which we can address misinformation around maybe creating like chatbots for people who actually use WhatsApp or the internet or digital devices. And that could be a way of informing people about misinformation and by promoting facts. So you can get this information from WHO, make sure you're getting information from trusted sources. And a challenging thing about misinformation is that things are constantly changing. So we're constantly learning new things about the virus. So things that we thought we knew before might become obsolete next week because we've learned something new. So it's important to keep your eyes open to what scientists are learning, to what the WHO is reporting, and then make sure that the information you're sharing is up to date. Another thing that I just want to mention about misinformation is that we tend to focus a lot on digital devices, like how do you use your digital device to spread information about prevention or spread information about misinformation, but not everyone uses digital devices. Or if people have mobile phones, they might not use WhatsApp as much as you do, or people who are in the villages might not be using WhatsApp as much, or some people might be unable to read. So it would be really cool if we as a community can come up with creative ways of spreading true information that does not require digital devices. So is there a way that you can get true facts to people who need to hear this in villages who might be very confused about this without having to do it through phones? I think that would be very innovative if people can come up with new ways of doing that. So as I mentioned, I have a blog where I am currently posted about misinformation. I've also posted about ways in which we could think about disease surveillance in sub-Saharan Africa. And I'm going to write a lot more about this as we start, analyzing data and trying to understand the data more. So I would say keep an eye out for that space. If that's something that's of interest to you, if you're on Medium, please do follow me. And if you have comments, questions, don't hesitate to reach out. Another thing that we're doing, the third thing we're doing is data collation. And I'm doing this in collaboration with Fukosi, who is in South Africa. And the goal of this project is to collect detailed and quality information on cases across Africa. And we want to know who's been affected, who's died, who's recovered. We want to know demographic information, location information, symptom for each reported case. And we're getting this data from official sources, so like the WHO, Departments of Health, Africa CDC, when reported. And then also unofficial sources like the news, because sometimes you have official sources who report cases and give details about them verbally, but they don't post that information on their website. So you might have multiple news sources who are keeping track of this, and so they're reporting in news. So the news is reporting the sources, and they're reporting this information, and that's something that we can get access to. Having such a data set is important for many different reasons. We can study the spread of COVID-19 across Africa. We can try to understand how it's similar or different to what we've observed in other parts of the world. We can use this data for answering many different research questions, from just epidemiological characteristics of cases to creating models to look at how interventions have impacted the spread of disease for different countries. And so it's a very important data set. And so if you want to contribute to these, feel free to check out our GitHub page. You can send me an email. We still need volunteers. We're always looking for volunteers. The more people we have, the less work every person has to do. So please consider volunteering for this. The last effort that I would like to mention is something that I've been thinking about. It's something that I've taught a lot about at Data Science Africa. I haven't done a lot of this myself, but I'm hoping to do a lot more of this in the coming weeks as I have more time. But a dashboard that I really like right now is the one by the Ministry of Health in Uganda. A lot of ministries of health across African countries are creating their own dashboards, but not all of them look really good. Some of them look okay. But the one in Uganda, I think, is simple, but is very informative. So you get information on the number of confirmed cases, the number of deaths, the number of people that have been tested so far, what contact tracing you're doing, individuals under follow-up, travelers and stuff like that. So it's a lot of detail. So if you go to the website and you scroll down, you actually have more information than what I'm showing you on this slide. And so there's a lot that you can learn. So if you're thinking about data visualizations, you can definitely link up to look at our GitHub page, extract some of that data that we've collected, and you can create dashboards like these that can inform people about coronavirus in African countries. Think creatively. You don't have to replicate exactly what other people are doing. Think about what kinds of questions would people want to know. And this is useful for informing the public about what's happening in your country, but it also informs the rest of the world as well. So there's so many things that we can do around this while I was stuck at home. But I just want to reiterate that the most important thing for us to do as individuals is to take care of ourselves and take care of the people around us. Make sure that we're practicing social distancing as much as we can. Make sure that we're washing our hands and taking proper hygiene measures to make sure that to prevent the spread of disease. We know that people can get infected, and even people who don't have symptoms can still spread the disease. So thinking about that, it reinforces the importance of social distancing. So because you don't know, just because someone doesn't have symptoms doesn't mean that they don't have the disease. So it's very important to create distance between yourself and other people to make sure that disease transmission does not happen. Here's my contact information. I'm hoping that you guys have questions. I'm looking forward to answering questions. My slides are not as long as I would have liked them to be, but here's my email, and I'm on Twitter as well. So thank you so much for your time. I've been tweeting a lot about coronavirus in Africa. That's my current focus. So if you want to keep track of what's happening, feel free to follow me. I will take questions.
Hi everyone, and welcome to the COVID-19 Data Science Virtual Conference. Okay, so my name is Odegua, and I'm a researcher at Data Science Nigeria, and I have my colleague here with me.
Hi, I'm Brain. I'm also a researcher at Data Science Nigeria.
So we want to welcome you once again to this live conference. So basically what we'll be doing in this part of the conference is to share with you our research work that we carried out at Data Science Nigeria. So we looked at how we can use data science and geospatial data analysis to help provide solutions or provide decision backgrounds for the government or for the respective organizations to help curb the spread of the COVID-19 disease. So I'm just going to quickly switch to our slides here. All right, so opportunities for responding to coronavirus pandemic. All right, so first, an overview of the COVID-19 pandemic. It's an infectious disease caused by a new discovered virus. It started in China, or it has been rapidly spreading across the whole world. Basically, the reason for the lockdown we are all facing today. So it is primarily spread through saliva, droplets of saliva, discharge from the nose, especially when an infected person coughs or sneezes. That is why we are always advised to not to touch our faces, not to touch our mouths and the rest, and to always wear a mask when we are going out. Okay, so currently there are no specific vaccines or treatments for the COVID-19, but scientists are actively working on getting one, and we just hope and pray things turns out smoothly. Okay. All right. So what are we trying to solve? So we looked at how we can use data science, geospatial data analysis, to try to solve a particular problem. And the problem we looked at trying to solve is allocation or situating hospitals or health centers in strategic locations that can help curb the outbreak, the spread of the disease. Okay, so we looked at how we can, because things like infectious disease centers and isolation centers are not things that you build every day, or they are not things that are existing out there. Okay, they have to be quickly set up by the government or by the body fighting this outbreak. So we look at how we can optimally locate a particular place that really needs these centers in the case of an exponential outbreak of the pandemic. So that's the problem we are trying to solve. We want to use data science and geospatial analysis to advise the necessary bodies on where to optimally locate these health centers or these isolation centers in a particular place. Okay, so that's the idea behind our research work. So the title is Optimizing Health Facility Allocation for COVID-19 Management using something called the Social Vulnerability Index and Spatial Data Analysis. And the SVI, which is the Social Vulnerability Index, is something we will talk about in the coming slides. Okay, so this is basically the title of our research work. Okay, so what is our approach to solving this problem? Okay, so we if you look at this, okay, I'm going to. Okay, so if you look at this box here, we have the spatial data, then we have the SVI derived data. They are all going into the resource allocation model, and from there we are getting our proposed optimal locations. Okay, so spatial data is what we got from we got this from places like Grade 3. Grade 3 is a popular place for spatial data for Nigeria. So we got health center locations from Grade 3. We also got population densities from these places. Then we also got road network. So this formed our spatial data. Then for the SVI derived data, SVI, like I said earlier, is the Social Vulnerability Index. And what is SVI? Okay, so SVI is simply a metric for calculating how resilient a place is to the outbreak of disaster. Okay, so take for instance Lagos State, for example. We want to know if a particular local government or a particular area in Lagos State, how resilient is it to the outbreak of a disaster or a pandemic such as the COVID-19 that we have. So if we can get this index, if we can get this metric, we can know, okay, this location is highly vulnerable, this location is not vulnerable. So we can use this metric combined with this spatial data that we have to, get the optimal locations that these new health centers or isolation centers can be set up. Okay, so the SVI composed of the socioeconomic status of the place, the household composition, literacy status, housing and transportation, which my colleague will actually break them down and tell you the components that we actually use from each of this session. But basically the idea is that we use this data, this SVI derived data, combined with spatial data, and we calculated a metric or an index that we use to. We also considered other things like distribution of health centers, which we'll talk about. But basically, we use these ideas or these metrics to calculate places that are highly vulnerable and also pinpoint specific locations that health centers can be placed to optimally curb the spread of the COVID-19 disease. So we used Lagos as a case study, and my colleague is going to walk us through what we did here. So, Brain, you have the floor.
Okay. Hi. So, Lagos is one of the most populated city in Nigeria. So we had to use somewhere that we can actually relate to very well. And from the statistics from NCDC, we see that Lagos is the state with the highest number of cases so far. So we had to use a case that we can totally relate to, which is Lagos. So like my colleague has said, the spread of COVID-19 is highly dependent on the social distances of people, and Lagos is a place that is very crowded, which makes it very susceptible to outbreaks such as COVID-19. So I'll walk you through our analysis using Lagos as a case study. So one of the first analyses that we did was the health facility per 10,000 population. This is an indicator set by World Health Organization to strengthening health decisions. So here what we did, we calculated all the health facilities from public domain, government, private, community-based hospitals, and we correlated it to the population of that area. So we could get the ratio of facilities to population. And as you can see from our legend, the light green is facilities, areas that has 8 to 15 facilities per 10,000 population. The leaf green, 16 to 30 health facilities per 10,000 population, and 31 to 80. So, and there's also another indicator set by World Health Organization, which is the health hospital beds per 10,000 facilities. And for Nigeria generally, we have a ratio of 5 hospital beds to 10,000 population. So correlating it with these places now, for example, here that's 8 to 15. So let's just take for an assumption that maybe here is 15 actually, because it's between 8 to 15. Let's just say here is 15. That means this place has 75 hospital beds per 10,000 population.
And that's very low.
And that's very low. But this cannot also really guide a full decision, because some places are less populated.
Yeah.
So you don't expect a place that is dense, less populated to have a lot of hospitals compared to places that are populated. So this could not really drive our analysis fully. So we had to go further to understand the areas more, which led to the second analysis on the social vulnerability index. So, like my colleague said, that this was derived from 4 domains: social economic status, household composition, literacy rates, and housing and transportation. Okay, social economic status is just like the ability for people to get funds that assets and finance to help them prepare and fight outbreaks such as COVID-19. And in every society, we have different classes of people, and which makes people that have the lower class, like financially, to be more vulnerable to outbreaks such as this. So we consider factors like poverty, inaccessibility to water, inaccessibility to proper toilet, inaccessibility to electricity, inaccessibility to mass media. So those are some of the factors that we consider under the social economic status. Then housing composition. We have 3 groups of population. We have 0 to 14, 14 to 64, 65 and above. So from these classes, we can see that the 0 to 14 and 65 and above will be highly vulnerable in terms of outbreaks, because someone has to care for them.
Like, are you talking about the age?
Yeah, the age classes.
Okay, the age classes. Okay.
So people between 0 to 14 and 65 and above will be highly vulnerable.
Okay.
So we had to take more data related to this. So we looked at the population distribution from 0 to 14, population density from population distribution from 65 and above, number of pregnant women, number of disabled people, because these are people that are actually going to be affected if outbreaks like this happen. So we looked at those key factors to make the household composition metric. So also we looked further into literacy status, because in terms of outbreaks such as COVID-19, risk communication is paramount. Yeah. So because it's a different thing when you're telling people do this, and people don't really understand that. So we had to look into literacy status. So what we used to build formulate this metric was things like attendance, primary school and secondary school attendance rates, illiteracy in English and illiteracy in other languages. So we can actually guide if these people really need another language to actually talk to them. So we looked at literacy in English, literacy in other languages, dropout rate, access to formal education and so on. So we use those to build the literacy status metric. So and lastly, the household and transportation. Like COVID-19 is highly dependent on population and crowd, the population of a place. So for example, Lagos now is highly populated and crowded. So we looked at housing transportation in these areas. So first of all, population density is very important. Road density is very important. Ownership of cars, because in terms of an emergency, someone that has a car will be able to get aid faster than someone that does not have a car, because, for example, maybe 2 a.m. in the morning and stuff like that. So we considered car ownership, and we also calculated we also collected accessibility to third road instant. So it's unfortunate that maybe you're an emergency and the road that leads to the hospital is very bad, so that will inhibit your chances of getting the aid quicker. So we also looked at the inaccessibility to third road. So with those factors, we were able to derive the SVI, the Social Vulnerability Index, which is just checking the vulnerability of a place based on social economic status. So and for this data set, we restricted our analysis on a local government basis, like the local government of Lagos. So that's where our analysis were covered.
Okay.
So also currently now the infectious disease hospital,
I think you forgot to mention this is the result of the SVI that we calculated.
Okay.
So like the red points. What are they?
So from our legend, we can see that places that the yellow places are low, have low vulnerability rates, and the red places has high vulnerability rates. So places like this.
I believe that's Ojo.
Yeah, this Badagry,
Badagry.
this Ojo, this Epe. So places like this, from our analysis, are prone to be highly vulnerable in outbreaks such as COVID-19. And the yellow places have a low vulnerability index.
Okay.
So that's just like the analysis, the result from the analysis, XVI calculation.
Okay.
So okay. So currently the mainland hospital at Yaba is the one handling the COVID-19 patients, and with the exponential growth of COVID-19, it tends to show that if you don't act now and have other plans, when those hospitals get saturated, full, it is going to have a hit on the medical facilities in terms of morale, in terms of facility, like the medication, how they're going to distribute it because of the population. So we thought, okay, let's see how far this hospital can go, like the coverage of this hospital in terms of area. So we looked at 2 kilometer.
I believe this is like the only infectious disease hospital in Lagos.
Yeah, currently that is accepting
COVID-19 patients. So this is like the coverage area of this hospital, right?
Yes. So we looked at 2 kilometer radius. We also looked at 5 kilometer radius, and we also looked at 10 kilometer radius. And from here, like going above, like drilling up, we can see that it's not really covering.
It's not even getting to the
vulnerable areas like this.
Communications.
So this tells a question that it's evident that the period of infection and hospitalization is key in curbing these outbreaks such as COVID-19. So we need to actually be able to reduce such distance, because imagine someone living somewhere here, moving the person down to here is going to take a lot of time, and the person could infect people along that way. So we really need to place optimum locations that can actually cover the whole of Lagos. So which led to the next analysis,
which is our proposed location using these metrics that you just mentioned. Okay.
So here, this is our solution. So first of all, we thought of, since we are working with government, so we had to filter the health facilities on hospitals that the government can actually drive their policies
quickly.
So
they are government-owned institutions.
Yeah.
Hospitals, okay.
So we excluded the private hospitals because it's a private-owned company. So you can just say he wants to shut down, and there's nothing we can do about it. So we had to drive our decision based on the ones that the hospitals, the government can actually influence, and the federal government can actually influence. So we filtered based on government-owned hospitals. So and from our analysis, we also overlaid the settlement heat map to understand where people were highly situated, so we can actually like do some cluster analysis. Because for example, from the map, I know maybe some people will be pondering why would they place a hospital here. From the settlement, it's from the settlement layer that we overlaid, it was evident that this place were not even
sparsely populated.
populated with people, so it's not really efficient for us to put a hospital where it's
I know we are trying to optimize it, so we're trying to reduce cost and the time
trying
taken
to reach people
to
too.
cite this. Yeah, okay.
So from that analysis, we can able to gain clusters, and these were the three choices of places that we made to actually reach Lagos. For example, the infectious hospitals around here. This is covering the vulnerable places such as Badagry, Upe, and Ife. If you
Yeah.
can remember here. So it's actually covering those areas and having a wider reach on people based on the settlement that are there.
And even can you go back to the other side? And even this location we're talking about, you can see is, although is there's medium vulnerability, is not too low, combined with the fact that it is not too populated. So you can see these are some of the reasons why we situated hospitals here and not here. But three is just a number that we picked. It can actually be increased.
Yes, based
right?
on resources.
Yeah, so it can actually be increased.
And also like emerging market like Nigeria, we don't really have like the money, like finance, to actually build structures, new structures to
Especially with the time that we have.
time that we have, just like China did in like 20 days, right?
10 days.
10 days. So we don't really have that manpower. So we looked at hospitals that are functional, ones that have been abandoned, rehabilitated, just constructed. There are different classes of hospitals that fall between the functionality status. So instead of government to actually think of places looking for new sites to build
Building a new
hospitals,
hospital from scratch.
so they can use this analysis and know places that are abandoned. Probably you just need to revamp the place.
And Optima.
Yes.
Optima in
Yeah,
terms
in
of
that area.
coverage. Okay.
So that's what we did. So we can actually choose a hospital. We are not actually giving them like a location to actually build. So we're actually asking them, okay, these are the hospitals around here in terms of capacity, in terms of location, in terms of population reach. These are the places that you can actually cite this stuff. So that was all of our key drivers for making decision here. So
Okay, so basically, using that analysis, the SVI analysis, we came up with the proposed centers, that's the names and even their coordinates. So you can see we proposed General Hospital Badagry, we gave the coordinates, the location, the Battalion Medical Reception starts, and Agboa General Hospital. And we also, if these places, for example, maybe they are overflown, we also propose alternative centers that are close to these areas that we believe, not actually we believe, that from our calculation can optimally help to curb these COVID-19 challenge. So basically, that's the idea behind our research work. And this is not this is a proactive research work. It's something that can be used to make decisions. Okay, and it is not just restricted to Lagos, Nigeria. It can be applied to any state. It can be applied to any country. So far, we have the right data. So, and the data is something we can easily get. So this is something we can extend to other places. So that's basically our research work, and we are happy to share with you. We love your feedback. Okay, I think that's the end of the slide. We love your feedback. We love
drop
your
your
comments. Questions, you can drop them in the live chat session, and we
answer them.
answer them and get back to you. So
Thank you very much for listening.
yeah, so thank you very much, and remember, stay safe,
Wash your hands.
stay at home. All right, so thank you guys, and bye for now.
Hello, good evening. My name is Wuraola Oyewusi, and thanks for joining our virtual conference this evening. This evening, I'll be taking us through an hands-on exploration of the COVID-19 open research dataset, popularly called COVID-19. So this is a summary of the dataset from the official website, and it's a dataset gathered in response to this pandemic, this COVID-19 pandemic that is ravaging the whole world. And there are about 45,000 scholarly articles and 33,000 with full text, and they are just data sets of articles, and they are very useful for natural language processing. A competition is going on Kaggle about this, and it's both a teaching opportunity to know how to work with data sets like this and to explain further for people that will be working with this kind of data set. There are different subsets of the data set. There's the one for commercial use, there's the non-commercial use data set. For this particular presentation, we'll be using the non-commercial use subset, which is just about 41 MB, and we'll be working from a collaboratory notebook. The purpose of this class is to take newbies, people that have been working with text data, but they've not worked with health data, or just people that are interested in seeing how a data set runs from beginning to the end. Okay, so we go to the notebook. Okay, so this is the notebook, and here's a link that can download the data directly to the notebook. I use WeGet a lot, so that it just downloads to the notebook. And this link was copied from the official website, and so we can just run this. When I started learning how to code, one of the scariest things was when I found a compressed data set. So this data set is compressed by gunzip. Sometimes I just try unzip or gunzip, but this works for this, just to decompress it. And then you can run the tattoo to extract the file. And this is what it looks like. When you're working with data sets like this, I think it's just what you should know as a data scientist. It won't always come as a CSV and things like that. And let's count the number of files in the compressed data. Okay, so let me show the part of the data. This was what it looked like at the beginning when it was just the tar data, and this is it when it has been compressed. I wrote this basic Linux command will count the number of files in this data set. The official documentation says 2,350 files. That'll be difficult to count from here. So you can just use this, your normal ls, and then you can do word count and then yes. So we have 2,350 files in that folder of academic text, of things related to COVID, of things related of journals that have been published that are related to this pandemic that we're working through, and we'll import some basic library. You can just you can run from here to run your cell, or you can just use Shift and Enter. Okay, to explore what one of the files look like, I think it's not that I think that is the most important thing when working through any data set, just to take some time to see what it looks like. And so this is a sample file. If you're working with the collaboratory notebook or a Jupyter notebook, you can simply copy paths to any file here. Okay, let me copy the path to the second one. I use the first one in my pre-run. So since it's a live class, you can just do this. Okay, so we'll be reading this particular file and pre-run. The most important thing for me is to know the type of data that I'm dealing with. So you can just find out the type of that data, which I'm doing here. Okay, it's a dictionary, and a Python dictionary or whatever kind of dictionary. We have keys. These are the keys. It has a paper ID. It has metadata, abstract, body text, bib entry, ref entry, and backup matter. Okay, so if you check the values, a dictionary, we have key and value pair. So if you check and you have an idea of what the data look like. So it's an interesting data set. It has data in all these forms, but don't worry, we are going to disambiguate that. That's why we are here. Okay, so let's check them individually and see how they work. This is the paper ID. This is just a string of the SHA. And okay, how did I know that the metadata has keys? Okay, I attempted to check the type for metadata. Metadata was here, and the fastest way is just to check the kind of data that it is. So it's a dictionary. If it's a dictionary, it has keys and it has values. So let's see the keys in the metadata. Okay, it has title, it has authors. Remember that this data set that we are exploring, it's a collection of journals, and for all the keys that are in the main file, nothing here mentions the title. So the title is in the metadata with the authors. So let's check the keys. Okay, so it has a key of a title and author. So if you're looking for the author of a particular data set, the formatting of this, it's in the metadata, as it should be for any kind of paper. And for abstract, I just decided to click keys, and it tells me what it should tell me. It says that list of data has no attribute keys. That means even though metadata is a dictionary, abstract is not a dictionary. So let's check the type of the abstract, even though the error message is clear that it's a list. So, okay, that is a list, a very interesting list. And let's have a view of what that list looks like. And Okay, so this is what the abstract list for this particular paper looked like. The initial paper I tried with was quite longer, but we can see that it's a list of dictionary showing the site span, the reference span, the section, and the name of the section. It says abstract here, and the text of the abstract. And this one says accurate and rapid diagnosis of highly pathogenic avian influenza is of critical importance for effective clinical management of patients. Yes, this data set is not just about COVID. It's data set about related diseases, papers that have been written about flus, about SARS, and it's quite interesting, and I'm curious about the kind of things that people will find. It's a text mining competition, and whatever things that you want to try with it as a data scientist, or a body natural language processing person, or a clinical natural language processing person. And let's check the text. It's also saved as a list, and this is an idea of what the list looks like. This is quite a well-arranged data set when I tried it across. When I tried all the formatting, it's well formatted. Big ups to Elaine Institute that did that, but this is how big the body of the text is. It's been annotated, and I'll say it's cool. But this particular scrolling that I'm doing is just through one of the papers, and we have 2,350 in this particular data set that we're exploring. So you can see why there may be a bit of difficulty loading the data set directly, There's really no fast and straight way except to explore, and that's the purpose of exploring data sets like this. So this is what the text looks like. It looks like if you're not used to working with data set like this, it looks very complicated. But this is machine friendly. It's been annotated. It knows the beginning. We know the end. It shows a span. And again, this is just a single paper. So I understand if it's been quite difficult. It took me many hours to figure this structure out, even though there was the official README and all that. Many times you don't know what you find except to check. So, and that's part of why we are checking. We are hoping that this will inspire you to start from where we stop here, to explore other interesting things, to mine this data. Maybe you find insight that other people have not found and things like that. Okay, the bibliography entry, it's a dictionary too. So it's mostly a mix of dictionaries and lists. That's the format of this data. Okay, so let's move to an interesting part. So for this data set, I saw this code snippet online. I spent a lot of time, trying to figure out how we are going to clean all this data set that we've seen. Big ups to Zulu. I saw the snippet and I just felt, after trying and writing the codes in short snippets and all that, this works fine. This is the reference to his main notebook, and it was writing a general function, to clean this, a series of functions to clean this particular COVID-19 data set. A lot of people are working on it online, and I hope you try to. It's part of why we are here. So the snippets, and that's the link. Okay, and to explain the snippet, this is to format the author. We could see from where the format the author is, and he made notes that not all of the authors are middle names. So I like the way he started that code, or she. I don't know if it's he or she. And with this function, this code snippet is quite specific to the formatting of this data set. Both this subset that we're using, or anyone, they are all formatted the same way. And affiliations have to do with the institutions the owners work with, or the location, and all that. And yes, formatting the body. If you remember slides ago, the text in the body of the text has been annotated, and to put it back up so that it looks as a single text, and you can work with it, not with the annotations and the spans and the references. And he wrote this interesting function to absorb to put into shape the most important things. The paper ID, we would like to know the title. Remember, the original JSON file does not have title like that unless you dug in and you pulled it out of the metadata. And that was why I did that run through a raw data that has not been processed. So at the end of this, so when a list of the data set has been extracted, we put it in a big pandas data frame. I use a lot of pandas in my text preprocessing, and let's see this. Generate clean DF. Okay, I put this twice. Let me delete this. Okay, so we explored what the typical JSON file of this dataset look like, and now we are going to run just a simple for loop through the entire folder. This is our folder, non-commercial use subset, and we'll append it into a big list, and that list is going to be put into a pandas data frame. So that was quite it's not slow. Like it has done that for 2,350 files, and part of why I like programming. But just to be sure that I got it right, I usually do these checks. So let's see the length of the files. If you remember from the beginning, we are working with 2,350 files, and let's see the pre-processing there is done. Okay, so I have a list. I have a list of loaded JSON files in a single big list, and let me just check again. I know it's a list. Okay, so now it's now time to put that old data, the extracted values that we want out of this, into a pandas data frame. And then we have this. It says generate clean df is not defined. I have not deleted the wrong code. Let me see. Well, I'm surprised it says it's not run. I think I forgot to run this snippet. Okay, let's go back. Okay. Okay, so all the data that were in JSON file, we are putting them into a big data frame. And the first thing I usually just do, let me check the info. Let me have an idea if it's caught the right thing. The first time I tried this, it says just one value instead of 2,350. Before I found out that I missed an indentation in the generate clean data frame source code, but let me stress about that. Okay, so let's see the head of non-commercial use subset of the data. I must have written this test when I was using random names. This is quite a large data set that viewing the first 5 out of the 2,350 took a lot of space. Like a lot. You just find yourself scrolling and scrolling and scrolling. But let me see what came out of that. Okay, this looks okay. Okay, so these are the first 5. These are the first 5 papers. They are now tidy. They've been put in a good format, and we are trying to scroll to the top just so that we are sure that we have what we want. You can simply use the data frame name and columns to see the head, but I'm just using this opportunity to see what the data look like. And okay, so we have paper ID, we have title, we have authors, we have affiliations when they have that, we have abstract, and we have text. For most of the people that will be doing NLP related tasks with this data set, your work will probably be with abstract or the full text or the name of the author. And then let's say you've cleaned that and you want to save as CSV. I'll save as CSV because it was quite a long process cleaning it from JSON. So let's just do our normal CSV and let's see. And whenever you are saving from a pandas frame, data frame to CSV, remember to declare index false. The default value is true. That means sometimes when you load some pandas data frame, you see double indexing. Is because okay, maybe when it was saved. So remember to add false, and if you want to try, you can change it to true and see what happens, or you can leave it blank and see what happens. Okay, so and yes, I remember to compress it. Pandas usually just infer. If you put a sub what will I say, postscript, I'm just saying make it a GZ file, so compress, so it's inferred compression. But I'll test again. I've saved this as a CSV, a compressed CSV. So let me just see if it's properly saved and see what happens. I just gave it the generic name, compressed, and then let me check the head. Okay. Okay. Saving it as a CSV did a fantastic job of reformatting it. I like that the lines are now straight. It's no longer rugged. And okay. So here you have your text for each of the paper ID. For each of the ID, you have titles, you have names of authors. Many of the papers were co-written. You have names of the authors. You have this is a system biology approach, and well, we kept the raw bibliography files. We kept the raw authors when it was still in this format. But for me, if I was working with this, I was.
Hello guys, my name is Olawale Victor and I'll be talking about the epidemiology analysis on the risk of coronavirus COVID-19 infection in Nigeria. Okay, in Nigeria. Yeah, a brief overview of what I'll be discussing today. I'll be talking about the introduction briefly to COVID-19. I'll talk about COVID-19 in Nigeria, COVID-19 in Africa, the assumptions of my model, the methodology, my simulation study, and my results. Okay, yeah, I also like to talk about Data Science Nigeria. Data Science Nigeria is a non-profit organization which is founded by Dr. Bayo Adekanmbi, and one of our main goals is to build a world-class artificial intelligence, knowledge, research and innovation ecosystem that delivers high impact research, build research, business use application, locally relevant AI startups, increase employability and drive social good use cases. And one of our major aim is to build 1 million AI talent in 10 years. If you want to know more about us, you can dial in to you can check datasciencenigeria.org and you see more and more about us. Okay, here is about me. My name is Olawale Victor. I'm a data analyst and a researcher at Data Science Nigeria. Here is my official email and that is my Twitter handle. You can always contact me and I'm happy to respond. Okay, yeah, coronavirus, which we know as COVID-19, is an infectious disease which causes respiratory illness, and with that it leads to symptoms like cough, fever, and in worst cases difficult breathing. It started in China, I think last year, and with that we have different countries that have been recorded with this virus. Okay, so with this virus in Africa, according to the World Health Organization, as at April 3rd, yes, that was yesterday. Okay, not less than 1.08 million cases have been discovered, and about 58,392 deaths, and also about 227,989 recovery cases. Okay, and out of all of that, about 7,117 cases has been discovered in Africa alone, and about 1,000 cases itself has been recorded in South Africa. Okay, yeah, and Apart from that, um, United States of America, Italy, and Spain found itself to be to be countries with the one of the greatest outbreak, the worst outbreak, and as a matter of fact, over 100,000 cases has been discovered in each of these countries, respectively. We can see that, and based on that, we can see that the rate at which the virus is spreading is growing exponentially. Okay, the first cases of the first confirmed case of the pandemic in Nigeria was on the 27th of February 2020, when an Italian citizen in Lagos was tested positive for the virus, and later on around March 9, the second cases was reported at the Wekolo, where a Nigerian citizen had a contact with the Italian man, and as at today, we have as at yesterday rather, we have about 190 cases discovered. Okay, the main objective of this research is to build a conceptualized model whereby we will know the kind of spread, the way the virus was spread in a particular period of time, if there is government policy effect, if there is a light policy effect, and if there is a high policy effect. We also want to know when the virus will reach its peak and when it will decline, where there will be no virus no more. We are estimating. Okay, and here is my methodology. One of the model I use is SIR model, and SIR model works in a way that it separates the population of individuals into three classes, which are the susceptible, the infectious, and the recovered. Okay, and there's actually an epidemiology model. Okay, and so based on that, I'll talk about the S, which is the susceptible, which are the people in the population that are not sick yet but are prone to the disease. The I is the infectious, those that are sick right now, and the R is number of recovered cases. And we have different parameters which we might build on later, which are the infectious rates and the recovery rate and the transmission rate. Okay, based on this model, there are some assumptions I made, which are, okay, we assumed that the population is fixed. We did not consider weather conditions in this research work, and we did not consider the effect of natural death and birth rates. Okay, and also we should know that our beta, which is our transmission rate, has the effect of government intervention. Though these parameters, we can build on them later. I'll discuss more about that later. So the simulation study is we carried simulation study on 3 stages. The first was using a statistical package in hierarchical epimodel, and we used a population of 1,000, and it was based on different cases, different scenarios, like when there is zero effect policy, when there is light effect policy, and where there is high effect. And also the second thing we did was building an XIR model to estimating the prevalence dates and when it will decline. And we used the total population of Nigeria from Worldometer as at April 3rd, 2020, the total number of infected cases and the total number of recovered cases. And the other parameters are calculated accordingly. We calculated our reproductive number with R2, and here is the result, and here is our main result. Now the main result is here. The first case is when there is no policy effect, No policy effect is in the sense that when there is no government intervention, and we can see from our right hand side which is the prevalence at day 1 and the prevalence at 100 days. We can see that during this period some people had the virus, and at the same time those people recovered, and that is it when there is no government policy effect. Okay, now this is the second case scenario where there is light policy effect. We can see the way at which it the effect changes. There is no much infection, but it is not as good as the third, where there is high policy effect, whereby those that are even contacted that were recovered are not that much. This is where there is high policy effect. Okay, and this is my main result on the SIR model, whereby I used the total population of Nigeria, as at yesterday, 3rd April, the total number of cases as at 3rd April, the total number of infected cases as at 3rd April 2020, and the total number of deaths. And I used it to build this model, to simulate this model rather. And at the end of the day, we were able to estimate that the disease, the virus, will reach its peak in 25 days time, and when it reached the peak, it might reach its peak in 25 days time, and at the same time it will decline down up to 50 days before it vanishes. And what I want to say about this is government intervention about the lockdown is actually a good one, and if we all comply with this and stay in our homes, it will be a safer thing for us, and we will experience something like this whereby a lot of people will not be infected. We can still control it, and we will now bring our country back to the way it was before. So I advise you guys to stay at home. Thank you. And if possible, if in any case you want to contact me, here is my email address and my Twitter handle. Thank you.